we are, we have the WHO, and Fran, I want you, to get into some of those specifics in terms of the programming. But Osman, if you can kind of give us some comments, and then I'll turn it over to Fran, because there are distinctions into how we move this forward, right? There are, distinctions of things that may always remain in terms of technical assistance for primary health, and how we deploy some of that healthcare. There's the blended financing that we've talked about. And then there's models that, Colin and Phyllis started at the top of the hour in terms of sustainability and really focus on sustainable solutions. And I'll let Fran guide us through that. But Osman, if you can, offer some framing as before we turn it over to WHO, that would be great.
Sure, thanks, Joanne. So one point I'd like to really underscore, I think was referred to slightly, but I think merits sort of reaffirming, is the fact that, in our healthcare systems, there is a trust deficit. So it's not just physical access, but it's also, your trust in the system. And even there, the impact of empowered lady healthcare workers can be phenomenal, right? Because they're they're extended members of your family. And this distrust plays itself out in even the West, where you see the anti-vaxxer phenomenon. In Pakistan, there's beyond trust also cultural barriers. Dr. Huma referred to the fact that half of our births take place at home because women are just not allowed to leave their homes, even to give birth. And over there, if you have a lady healthcare worker who's properly equipped and trained to make interventions at home, at site, with the families, the impact they can have on the mortality numbers, on nutrition, is really dramatic. And that's why, this model, with all the elements that we've spoken about, capital financing, whether it's microfinance loans, microinsurance, being part of a microinsurance solution, or the larger government, social safety net response, SAS, which is also run by an extremely competent female leader, Dr. Sania Nishtar. So I think there are all these, great, elements are together almost in a perfect storm for something like this to be really tested out on the ground in a country like Pakistan.